Afternoon, everyone. We're here to talk about healthcare for the early care and education workforce. I'm going to start with a brief overview of what the issues are and the ways that you can help. And then I've asked three of my colleagues from different states who are engaged in actually rolling this out in their states to share just briefly lessons there. So we're going to be hearing from Jackie Cowell from Early Learning New Hampshire. Jackie, you want to say hi? There you go. We're going to be hearing from Paula Drew from Wisconsin and Judy Williams from Colorado. And so without further ado, let me get started. For those of you who know me, know that I have been really focused on trying to address this issue of health insurance for childcare providers forever. It has been, since I got started in the shared services work, this is one of the things I've always wanted to address, and quite frankly, have been unable to do so because it was just impossible for us to be able to really navigate the health insurance markets via a shared services strategy in a way that was still affordable for our providers. But bing, 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 we're now in a new world. And because of investments in the Affordable Care Act, we actually now have the opportunity to make affordable health insurance available to all of the childcare providers that we work with. And so the purpose of this webinar is to really encourage you to step into this space. We're going to be talking about three things that you can do to do this. And we're going to talk about investments in the Affordable Care Act. We're going to talk about the telehealth plans that we've been able to make available through shared services. And we're also going to talk about how childcare providers can use the ARPA stabilization grants they get to also invest in insurance premiums, as well as tax-free accounts like health savings accounts and health reimbursement accounts. So basically, this slide is kind of a quick cheat sheet about things that you can do. And today, we've done previously webinars, Sharon and I, on strategies for providers and programs. Today, we're really speaking to alliances. What can you do as an alliance? And so here you see three boxes of the things that I just mentioned. And each one of these is hyperlinked so that if you click these links when you get this webinar, it will take you directly to the page on the healthcare marketplace where you find a Navigator, directly to the page on Docs by Phone on the ECE Shared Resources website where you can find the Docs by Phone information, and directly to the IRS publications where you can understand more about health savings accounts. So that's kind of just a summary cheat sheet for you. Now let's go in a little bit deeper into your role. So the number one role that you can play is to talk it up. I think, whoops, sorry, providers just don't know, they're not aware that health insurance is really affordable on the marketplace, because it wasn't necessarily in the past. You know, when Affordable Care Act first came in, we all thought affordable was the key word, and it wasn't always affordable. Now it is. So spread the word. And before we leave, Paula Drew is going to pop into the chat box actually a toolkit for even more resources that are coming from the federal government about how to spread the word. Secondly, securing a healthcare navigator, and we'll talk a little bit more in a minute about what a navigator is and how you can secure one. But basically, navigators are there, they're free, they're paid for by the federal government, and their job is to help people find health insurance. If your state has a license for the Early Care and Education Shared Resources, the EC Shared Resources website, and about 32 of you do, there's a really affordable teledoc plan, and we'll talk a little bit about that. And actually, our partners are going to talk about how they're using it. If you're not one of those 32 states, maybe now's the time to become one. Or you might be able to find another affordable teledoc plan in your state. And then also really encouraging and working with providers about using their own money for this. So remember I said that rates were very affordable? This slide gives you a snapshot in just how much lower the rates have gotten in the past year. And it's our understanding that we're going to see these low rates sustained for at least a couple of years, if not longer. And so really, if you think about this single 26 grand female, that's sort of a sweet spot for our sector. And look at that, zero, free health insurance. And even for married couples, you know, we're talking about plans that are $200 a month. These are affordable rates, guys. we can totally do this. Okay, so how does it work? Eligibility for the Affordable Care Act is individual. This is really important to know. This is not about the director buying a group plan or you as an alliance buying a group plan. Each individual goes to the Affordable Act to apply for health insurance. And the cost for each individual plan will be based on their income, their family income. So, but you can request help going there. So that's what navigators are for. So you as alliance hubs or individual centers, administrator or owners, you can basically reach out and get a navigator. Maybe you do a group session with your entire staff, do a Zoom call. A lot of navigators will come on site. You could do a help desk, you do office hours. There are so many different ways to leverage navigators. The trick is to go to the ACA, find a navigator, reach out to them and make a plan. And the other thing that's really important, and this is where it's very good for you as an alliance to play a role. If you are working with childcare centers that formally purchased health insurance, it's going to be helpful to help them sort of think through, does it make sense for me to continue offering health insurance? Or should I actually stop offering insurance? Everyone goes to the exchange, including the director, and the money that was spent in health insurance then gets shifted into paying higher wages or paying for health savings accounts or retirement funds or other benefits. So it can be a win-win, but centers may need help sort of thinking that through, looking at budgets. That's a great role that you can play as an alliance. Now, here is one challenge and one negative piece. If you or your spouse is offered in health insurance through your employer, you are not eligible for the ACA tax credits. That is a real bummer and it's a problem, but it's unfortunately not a problem that we can fix. So that is definitely something that centers are going to want to find out, get a better sense. I mean, it's one thing if the center's off the insurance, they can fix that by not doing it. But if their spouse is getting insurance through another employer, that's so, and the issue is, and the reason this is an issue is because the family plans are often really expensive, and yet you can't say, well, my spouse is taking the employer insurance and my family's going to go to the Affordable Care Act. We would love for that to be the case, but it's not allowed. So that's where like health reimbursement counts or something may come in. All right, I want to go a little bit deeper into this issue about when you go to the marketplace. What you're going to see are two things. You're going to see what's called assisters, which is their word for navigators, and you're going to see agents and brokers. And you see this is actually a screenshot from the actual site, right? And you can click either one. Now, both of them can help you. I just want you to understand what the difference is between the two. So an assister or a navigator is somebody who is neutral. So they do not work for a particular health insurance company. They are trained and certified by the federal government, and they can help you and your staff apply and enroll in both Affordable Care Act as well as state subsidized Medicaid or children's health insurance. So they're really sort of broad brush, impartial folks to help you navigate the system. Agents and brokers can also sell plans on the marketplace. Agents and brokers are typically paid by insurance companies whose plans they sell. That doesn't mean that's bad, could be perfectly fine. But it's just important to understand that when you're working with an agent, they probably cannot help your staff sign up for Medicaid. They can make a referral. They can help your staff sign up for S-CHIP. They can make a referral, and they will only be selling the plans for which they're a broker representing. But the bottom line is there's lots of different ways to get help. What do owners and directors need to apply? So they're going to need their pay stubs or a copy of last year's tax return, something that shows their income. If they're self-employed, and this is another really important role that alliances can play. If you're self-employed, you're going to need to submit either a copy of last year's tax return or a profit and loss statement, something that estimates your likely income for the next year going forward. So again, if a family childcare provider or a small center doesn't have a P&L, that's something that you can help them create. or a financial document that will allow them to estimate their income. Another helpful tool on this page is the Kaiser Family Fund actually created this nice little online health insurance marketplace calculator. This is not an application. It's just a place to go, click it, put in your income, and it'll give you a sense of what your likely premium is going to be and for insurance. So it's a good sort of quick check. And then also on this page, just to clarify, from the federal government's perspective, open enrollment is from November 1st to January 15th. However, some states have different end dates. So some states are ending this a little bit earlier or extending it longer. So you want to make sure that you check with your state. And actually, this is hyperlinked. So if you click that different end dates, you can actually go and look and make sure what your state's end date is. So again, I mentioned this issue of there are other ways that you can, so there are 3 strategies we're talking about here. We're talking about health insurance. We're talking about help paying for out-of-pocket costs like health insurance premiums, and we're talking about teledocs. So this slide fits into that second piece, which is how else can you help your employees pay for out-of-pocket costs or, for example, premiums if their spouse has a plan. And there are 3 ways that you can do that: through health savings accounts, health reimbursement accounts, or flexible spending accounts. And this is just a little chart that quickly gives you a sense of the pros and cons of different ones. I'm not going to go into detail. There's a lot of detail under this. And this, you definitely want a navigator or a broker to help you figure this out. Probably actually a broker is going to be a better benefit in this case because it's an employer trying to figure this out. All right, now let's talk about telehealth. So health insurance is great. However, most health insurance plans will have a deductible. And those deductibles can sometimes be deal breakers, especially for low-wage employees. So what's cool is pairing health insurance with telehealth. Telehealth offers 24/7 access to a doctor by phone, video, or any kind of mobile app. Doctors are board certified in your state, so they can write prescriptions. There's no copay for docs by phone. So if you purchase a docs by phone plan for your employees, they get free access for any member of their family to a board certified doc. For an additional fee, you can also include mental health teletherapy. So that's another option. And these plans are available for as low as $8 a month per employee. That's for their entire family, $8 a month. It's a super great plan. I actually purchased it for myself and for my daughter because I just think it's such a helpful thing to have. So that's just a really quick overview. Now I want to give you really a flavor for what this looks and feels like in states. So I'm going to ask some folks to speak. And Jackie, do you want to pipe in? And I'll just move your slides. So why don't you talk and I will move your slides as you talk.
I'd be glad to. Thanks, Louise. How do you do, everybody? I'm Jackie Cowell. So I am from Early Learning New Hampshire, and we are the fiscal sponsor of our shared services alliance here in New Hampshire called State Early Learning Alliance of New Hampshire. We call it SELA. And so we heard from Louise back in May about this whole concept of could you cobble together these 3 different pieces, as she described, to give really good health coverage that together really do a great job for health coverage for the early childhood education field. We had never heard about this idea. We know that we've all been trying to figure out a way to do it. And so since May, I would just want to give you a quick update of some of the things that have been happening in New Hampshire since we had her webinar. And we had over about 140 folks who working in the field, mainly administrators on the call. And so what was interesting is that, yes, we do have a shared services, ECE shared services web platform account here in New Hampshire. And what was fascinating is every single person on that call who had that platform had no idea there was docs by phone there. It's one of the things that we had not done a good job telling folks about it. And so right after that webinar, we had several programs immediately look into it. We have, I'll just give you a quick example. Even though Merrimack Valley Daycare Services does give health insurance to their employees, they decided to also do the docs by phone because they have a big high deductible. And so she is paying for it for her staff. I think it's $8 or $9 a month per employee. She thought it was well worth it. And right after she announced that and gave it out, one of her teachers' teenage son had a rash. Within an hour, she was able to sign her teenage son up for her plan. And he had a Zoom call with a physician who diagnosed his rash and gave him a prescription. And so she easily would have had to spend about $100, getting and many more hours trying to figure it out. And so she was just delighted. So again, it's getting that word out, using your alliance to get that word out about some of these opportunities. And so we're purposely doing a better job letting folks who are in the shared resources platform know about docs by phone, help them access it and use it. And more are starting to do it. And then the health savings account, if you don't mind just going back, Louise. In the health savings account, what we've learned here in New Hampshire is that we have very few plans here in New Hampshire, and the ones that allow you to have a health savings account have huge deductibles, like $7,000, which is unfortunate. However, we are going to be looking at the idea of flexible spending accounts, giving more information out about that, health reimbursement accounts. What we were able to do, we had at Louise's webinar, which I highly encourage you to do the way she did it for us in New Hampshire, is we had our DHHS, our Health and Human Services folks who are in charge of the ARPA dollars for childcare on the call. And they immediately changed the allowable uses of ARPA dollars of stabilization funds for programs to include health savings accounts and other kinds of flexible spendings accounts. It's an allowable use that they had not articulated before this. So we were pleased about that. Again, I don't know how many are actually using that because the stabilization dollars really are just enough to survive. They're not really giving them a lot of extra dollars, but it's an allowable use now. I had not heard of marketplace navigation prior to Louise's webinar in May. I didn't know. And most of the folks on the calls also didn't know. There was somebody out there here in working for New Hampshire, helping individuals navigate the ACA, the marketplace. And so they not only were able to join Louise's webinar, they also joined several different Zoom calls that we've had. In fact, one recently to remind folks again about the fact that we have this opportunity for enrolling now through from November 1st to January 15th. And again, a lot of directors, we're writing it down and giving calls, already emailing the Navigator. Yeah, I want some help. I want you to come to a staff meeting. And go ahead if you don't mind changing the slide, Louise. So what they did, and they'll do it for you, they'll do it for your program, allowance, they'll rebrand it for you, the flyers that they have. So we also learned on this recent call that he'd been contacting different childcare programs. They all thought he was a salesman and never answered his call. They had no idea he was free, available, helpful, independent. And so again, through our webinar and our conversation with childcare programs, about 10 folks that had heard from him and weren't going to answer him decided to email them right away. So again, he will help, he or she will help. It's really just been a big difference. We did have several programs that did switch over from paying health insurance to having folks go onto the marketplace and using those accounts, using that dollars to reinvest into their workforce. Most folks not yet. They're kind of wary about getting rid of their health insurance for a lot of reasons, but folks absolutely did find very reasonable premiums because of the pay scale. So I highly recommend you guys have Louise come to your state via webinar and do this for your programs. Thanks.
So the last thing that I would add is you don't need me. You could do it yourselves. You know this. I did it back before we'd been talking about it, but you've heard this enough, Jackie. I'm sure you can do this presentation yourself.
Now we can. Now
Yay, good. All right.
But others may need to hear you first.
All right, now let's turn to Paula. Paula, you want to talk to us about Wisconsin?
You bet. So my name is Paula Drew. I am the co-director of the Wisconsin Early Education Shared Services Network. We are becoming a statewide network of programs. We work with right now probably about 1,000 within 3 different tiers of services across the state. Very similar to Jackie's story, but slightly different. We are the license holders for the ECE Shared Resource Platform in Wisconsin. And I think in that same month, I think it was in May, on that call for all of the states that are part of the ECE Shared Resource Hub, they were highlighting docs by phone, and a couple of my colleagues were all on the call, and we said to ourselves, like, why aren't we doing something this within our network? And so after we got off the call, we talked to some folks at the Department of Children and Families here in Wisconsin that support our work. And we were able to use some CURSA funding to pay for actually both the docs by phone, telemedicine, and teletherapy for all family providers starting in our deepest level of services, tier 3. And then shortly after that, we negotiated a new contract with the state involving our 3 tiers of service, and agreed that anybody that came into tier 2 and all family providers and administrators would get access to and payment for the docs by phone, telemedicine, and teletherapy within our network. So that's one thing we were able to do right away, because it is very affordable, and whether you have health insurance or not, it is going to create like great benefit. What Jackie described as the kiddo with a rash, like that is, the perfect example. It's saving you time, it's saving you money. You're not going to have to take off work, and these are the types of things that really do impact somebody, especially who's working in a childcare facility right now. Those are really big things. It's hard to take time off. So also in that same month of May, we started a collaboration. Actually, take that back. A year ago, this month, we started a collaboration with a statewide healthcare navigator agency called Covering Wisconsin. So they have, just as part of their services, navigators available across the state to help people understand plans available to them on the healthcare marketplace and to apply for those. Last year, we engaged in a media campaign with them, in which we targeted specifically early care and education providers in the state, letting them know of the enrollment period and how they could apply for that and connect with Covering Wisconsin. Then, fast forward a year, there's now ARPA subsidies that are going into lowering the cost of plans on the marketplace. And so we were able to do a webinar for early childhood providers in the state of Wisconsin. I do believe we had over 100 people join that webinar. We did it in collaboration with Covering Wisconsin again, the Committee for Economic Development, that's our good friend Grace Reef, and a local healthcare policy agency called Kids Forward, to detail those new subsidies available within the plan that providers could use. And we also sort of detailed some of the immigration status that goes along with that and some other questions that programs had. And then going into the future, Louise, if you want to move to the next slide, our goals are firmly around ensuring that all providers in Wisconsin have access to comprehensive, affordable healthcare, especially now. We have deepened our work with Covering Wisconsin. We're doing a shared media campaign with them again this year, sort of folding in that toolkit that I shared earlier in the chat box and some other things focused specifically on the early care and education workforce. And we are deeply considering getting an in-house healthcare navigator that works year-long across WISN to help programs get connected to health insurance and make those decisions around offering health insurance in-house, providing those health savings accounts for their staff members. I think what Luis says makes a lot of sense right now. It's going to be a lot cheaper to probably just do the health savings accounts for people, but that takes a lot of good messaging and understanding about the complexities of those layers. We have our agency, the Wisconsin Early Childhood Association, has been for years researching PEOs so that we could be the provider of a health insurance plan across the board, but we know that it's not as as affordable than purchasing healthcare in the marketplace, but we continue that research along with people who are a lot smarter than us around all things healthcare related, because this is a goal of ours. So just sort of building off the things we've already got going, those relationships, those connections, leveraging our network to make sure everybody within the network understands what's available, how to access it. And then we just started in conversations with the state as well around the possibility of healthcare savings accounts and the allowability of using ARPA funds to put funding into those health savings accounts.
Great, thanks, Paula. And now we're going to go to Colorado. And Judy, why don't you tell us a little bit about what you're doing in Colorado?
Hi, thanks, Louise. I'm Judy Williams. I'm with Early Learning Ventures located in Colorado. We are a statewide shared services group. We offer 3 levels of services, and then we also are leveraging some of our services Alliance Core outside of Colorado. But the way that we approached it, I think same as the 2 presenters above, we heard Louise talk about this. And interesting, we knew Docs by Phone was on the shared services platform from CCA. And 5-6 years ago, we tried a whole campaign to get providers to try it. Not much interest. Even right before COVID happened, we tried to pitch it to a few funders on how it could help with, offering this for teachers to help so that they could actually, stay at work and things like that, and didn't get much interest. But come COVID, now there seems to be interest and more acceptability that telemed has a place in the healthcare scene. So the way that we're approaching it is we have some federal stimulus dollars. We are Early Head Start Childcare Partnership grantee for 42 childcare programs within our network, 350 Early Head Start slots. And so with those dollars that have been flowing, we've taken those dollars and we are providing the service for 150 of those Early Head Start providers, teachers, et cetera, as well as our staff members, because in this pilot, we want to see what is it like to just enroll everybody at once, have our staff members encouraging folks that they're working with to enroll. And we also are doing the unlimited health and mental health visits. So a little different, meaning we're trying to do it all at once and we're paying for it on a monthly basis. So we started in August. We're really trying to address even what we heard from providers, even, year after year, is a lot of them have access through Medicaid or CHIP, but in some of these rural areas, they can't even get in to see a doctor, even if they wanted to. So that's where we thought telemed offers that access for some of those reasons why you would need to see a doctor for yourself or your child, ear infections, things like that. So that's sort of where we were kind of coming at as an add-on, not replacing health insurance, as well as, the mental health services, which has become, there's a lot of different groups offering that, through what's going on in the world today. Everybody is really suffering that way, but trying to make this an easy way to access it. And again, really focusing on providers, our family child care providers that are with children all day long. And, they typically aren't getting a lot of access, even if they have access, trying to get the time to go and take care of that. So that's sort of where we're focusing in, and then really trying to, as we go through this pilot, what we're trying to really tell the story is that when providers have their health and mental health needs met, then you get improved outcomes for children in their care. They're ready to put their best foot forward. So I think that's sort of how we came to this pilot. Next slide, Louise, please. So what we're trying to do is demonstrate it, because we have these funds right now, and to demonstrate it with these 150, to then really try to go to the state and some of the different, funding systems that are coming out, that how this is a quality investment that can be made for all childcare programs, teachers. So, it's great for centers and folks to make these decisions on their own, but just like you can go and get support for all kinds of things to deliver high quality care, why can't this be a support too that's accessible and paid for by the state? So that's sort of our lofty goal in trying to prove this out in our pilot. Next slide, please. So kind of what we're doing through this pilot is we're looking at, these are the goals we've set. We've really, like I said, we rolled this out with immediately enrolling everybody into Docs by Phone. And so, there's been some lessons learned there that, again, I think everyone gets it. They said they wanted it. We did a lot of, surveys. We did a lot of webinars and, rollout of you're getting this is what you get. But we still need that touch to get them over the finish line, which is super simple, but it's just getting them to actually register and then to start to use the system. Those that have enrolled and actually finished the process, we're seeing really strong usage. And it's 50-50 telemed and mental health. So, we're still really focusing on those 150 to get them, really comfortable with actually going through the registration. And I can tell you Docs by Phone has been a great partner for us. They really are providing that support. But again, I think I heard one of the other panelists talk about, they feel like they're being sold something and not realizing, we're the trusted source, and this is something that you're getting because you're part of our alliance. So when it's branded, it's actually branded Ally Health, they get a little confused if somebody's trying to sell them something. So we've been working a lot through that. But again, these are our goals. We'll finish this pilot in a year. And through this pilot, we're really trying to talk with the state, other funders on how do we sustain this program and actually take it through our full shared services. In Colorado, we serve about 800 plus childcare programs through our tiers of service. So those are sort of our goals. And I think that was my last slide.
Yes, it was. Thanks
Okay.
a bunch, Judy. So I'm going to give you one more example of and this just came to us recently. And that's Iowa. So Iowa actually read the issue brief that we were working with some folks in Iowa, and they read the issue brief that we sent out on this. And they said, oh my gosh, we need to jump on this. So actually, in this case, the Department of Human Services actually they reached out to their R&Rs and said, hey, let's partner on this. Let's get outreach going. So they worked through their R&Rs to actually get outreach to all their providers. They're engaging their regulatory field staff and their R&Rs with an Iowa Navigator to really begin to sort of build out information as well as links to the Navigator. They had an evening meeting and a recording webinar that was, again, sponsored by DHS, but with the R&Rs, specifically targeting the childcare community. And they got the Navigator to expand their hours of operation to really focus on this particular sector. So what I wanted you to see is that there's many different players who can be involved in this kind of outreach and many different ways that we can touch this. So let me pause now and see, are there questions or panelists, things you want to add that you didn't say previously? We can open this up really for a much more informal discussion. In fact, maybe I'll stop sharing for just a moment. Do we have anything in the Q&A box?
We do.
Okay, go ahead.
Yes, we have a question from Grace to Judy. Where do the 150 in the pilot come from? Tier 1, Tier 2, Tier 3, EHS, local hubs. So can you give us a little more detail, Judy?
Yeah, so we have 3 levels of service. Our Tier 3 level is our deepest shared services. And that is with 42 programs. And that is really, the pedagogy side is really funded with our early Head Start dollars. Those 150 teachers come from that tier level. The one thing I did forget to say that we're getting a lot of, we've been trying also for several years, how do we connect with FFN? Because they've been hard to reach and support through our network. And this has really spoken to some FFN groups. We're really going through those trusted groups that are working with FFN, and they have high interest because they really want these services for their FFN providers. And so we have gotten a lot of interests from those FFN support groups to, when we're ready, our first expansion will be into FFN with this. That's one of the things that they are ready and really want to be part of this.
And I assume everyone knows FFN is family, friend, and neighbor care, but we'll just say it. So yeah, thanks. So there are no more written questions. So maybe we want to just open it up for panelists to some dialogue.
Yeah, and can people unmute themselves if they want to ask questions live?
I think people can raise their hands and
Okay.
I can unmute you if you'd like to ask a question.
Okay, great. Great. Jackie, go ahead.
Yeah, I thought of something I should have mentioned too, is that another a group in our state, Amy Brooks from the Early Care and Education Association of our Upper Valley. She works closely with the United Way folks in her area that are doing some navigation to the childcare providers in a variety of ways, early childhood education folks. And so they're going to be potentially adding health, this navigation around the marketplace, around docs by phone, around, making sure to use statewide Navigator. So that had not been on their list, but the United Way navigators may start adding some of this advice to their list. Cool,
that's great. A thought I had too when I was listening to both Paula and Judy was, in both cases, in both the case of Wisconsin and Colorado, the Shared Service Alliance has purchased licenses for docs by phone and made them available to the members of their network. So they've actually sort of said, we're going to leverage some of our resources to be able to help you purchase this so that you can get it for free. This is a super doable thing and it's very affordable. And I just want everyone on the phone to have their antenna up that there is money floating around. And sometimes you get these phone calls that money has to be spent by a certain deadline. And gee, could we spend some money fast? This is a great way to spend money fast. So I think that we're really in a great position to try to leverage some of these resources for providers and to get them out there. Other questions, comments, suggestions? Anyone from another state who's doing this work who wants to chime in and tell us your story? We're all ears. Well, if not, we can just go to the last slide and I'll tell you about the next webinar. Let me go back and, oh wait, hang on, there's something coming in. Oh, Grace is just saying good work. So let me go back to my PowerPoint here, and I'm going to share the next slide, which is telling you about our next webinar. So this webinar that you're on today is part of our virtual offerings, right? These are pre-conference sessions for all of you who registered for our conference that we had to postpone. We wanted to keep you engaged and while you wait for the in-person FaceTime. And our next webinar is going to be on Monday, December 13th at the same time. And it's going to be about business training, beyond business training, basically. It's going to talk about ways that folks are pairing training with childcare management software, onboarding, with business coaching, with peer networking. What we're trying to really do is figure out how do we overcome the forgetting curve, which is that 90% of what you learn in a workshop is forgotten in a week if it's not learned in context and it's not put in practice. So we're all really interested in and we're going to have a conversation about that next time. I'm seeing something in the chat. Is there anything else? Nope, just thanks. So, and for those of you, I would assume everyone on this call is familiar with our website, but if you're not, here's a link to our website, and we're doing our best to keep it up to date with tools and resources. And we'll see all of you in December. So thanks so much for participating. Bye.